Hello, my name is Adam Ristevski and I'm a first year chiropractic student at CQ University, Sydney. Today, I'll be speaking to you about my chiropractic rationale. This rationale will include the philosophy of chiropractic, the content that I've covered throughout the semester, and the future of the career. Chiropractic is a type of health profession which focuses on the diagnostics and treatment of the spine and the neuromuscular skeletal system, along with its effects of an individual's health. Chiropractic has been around for thousands of years, dating back to the ancient civilizations of ancient Egypt and ancient China. However, it came forth as a medical profession back in the late 19th century, discovered by a man called D.D. Palmer, the father of chiropractic, in 1895, and further expanded by his son B.J. Palmer in the 20th century. D.D. Palmer believed that there was a way in which people can be healed without the use of drugs. To this day, chiropractors still believe in this, hence why chiropractors use natural healing to assist in improving the function of the spine. Throughout history, the medical board has frowned upon chiropractic, and this still continues today, where they discriminate the profession as non-evidence based. This is one of the main reasons why I've chosen to do this course, to prove that you do not have to recommend drugs to heal an individual. In this semester, we've covered a variety of information about the chiropractic as well as its importance within society. One of the first things covered was palpation. Palpation is the cornerstone of assessment of the spine by chiropractors. It enables the practitioner to assess the structures that lie beneath the skin, soft and bony tissue, both superficial and deep, and then integrates this information into an evaluation of the area that requires palpation. Practitioners use their palposcopes, often their second and third fingers, to compare the differences in skin texture, temperature, muscle tone, and consistency and tenderness to touch of a patient. In addition to palpation, we were also introduced to ancillary techniques, also known as massage techniques, including effleurage, petrissage, roulement, lymphatic drainage, connective tissue massage, tapotement, and friction. Each of these techniques have their own benefits, however, they all subsequently release the tension within the muscles of the back. The following 2 weeks consisted of bone landmarks, using specific bones and determining where they are in correlation to the vertebra of the spine. For example, the inferior angle of the scapula is in level with T6, T7. The iliac crest is in level with L4 and the PSIS located on the same level as S2. These landmarks assess the practitioner in determining where they can apply an adjustment to the patient. Also, we were taught about posture and how poor posture can impact the center of gravity of a patient. Moreover, a major component we were introduced to was postural analysis. This is a test done from posterior to anterior and laterally, analyzing the posture of a patient. The terms kyphosis and lordosis are terms used to determine the degree in a specific region. A high lordosis of the cervical spine leads to forward head carriage, tight and stressed tissues of the neck, and lordosis of the lower back leads to pelvic tilt, lower back pain, and tightness in the muscles surrounding the area. In addition, we were introduced to range of movement and listings and star diagrams. This is another major component within chiropractic, as this allows the practitioner to physically see any defects in the movement of whole regions, global range of movement, and specific regions, specific range of movement. Star diagrams and listings are where the practitioner would note comments on the global range of movement and specific range of movement of a region that was tested on their patient. This is an example of a star diagram. Along the axis, you have different movements, and the chiropractor would use dots to determine specific regions in which a patient has issues with in regards to their motion. In addition, this allows the practitioner to determine an area which does not seem to be functioning correctly, and they will perform an adjustment to this area. The last few weeks of term included motion palpation and segmental motion palpation of the cervical, thoracic, and lumbar spines. These were all hands-on learning, allowing the class to be given a taste of what the fields of chiropractic is all about. As a whole, the content covered really gave me an insight of what the field of chiropractic is all about, and I thoroughly enjoyed it. In a future sense, despite the negativity and the field being talked down upon by the medical board, I believe that chiropractic is a well-respected profession and it has shown successes throughout its time in society. It is a growing profession being taught in major universities throughout the world and practices found worldwide, such as the United States of America, Canada, Australia, Malaysia, Japan, and Europe. In Australia, however, chiropractic is yet to be recognised with Medicare. However, I believe that this will change within the next few years as the profession grows. I'm very excited for what lies ahead in my journey, and hopefully one day I'll become a chiropractor myself. Thank you very much for listening.